Okay everyone, today's video I'm going to go over the medications that I take every day, and we'll start out with the first one. It's called Heparin, and let me go ahead and pan over and I'll show you. So this is a view of all the medications. I'll go through all of them one by one, and I'll put a description. I'll list them all in the video description, but I'll show you how I do the first one. So I get my little belt on, and okay, got my gloves. So the first thing I do, I'm gonna go ahead and get these needles in me. So you go ahead and just tighten up the belt, and you can see in the light where, like, these 2 points where the needles are going to go in. So it doesn't hurt. Okay, so the first one is in, and get a piece of tape, and you want to have a lot of pieces of tape ready because you're going to be using them. And so that's on there secured, and you want these little cotton things here. Put another piece of tape on it, and so that one's secured. And so go ahead and get the second needle, just pull that off again here. Okay, that one's in real easy. And if you're worried about the pain of the needle going in, it's truly nothing, but you know, if it's an issue, not a big deal, nothing to be ashamed about. There's a lidocaine cream you can rub on it. It numbs the area, and so, but I don't use it. And okay, so these needles are in secured. Just remove the belt. Okay, so now I'm gonna see, I'm gonna pull the blood. You see it coming out. Okay, clamp this. Second one. Okay, clamp this. And get more trash can. Okay, so these, you get one of these, you get a lot of these pre-filled saline syringes. And so this is the bottom one. You just see, get that in there. Okay, push that in there. Clamp. And okay, now this top line, I have to inject this heparin into it. And so you get these needles. It's 1.6 milliliters of this heparin that I put in there. So what you do is you just, you know, I unscrew this. See, it just comes right off. Unscrew it. Take this off, unscrew that, drop that in the trash, connect it, and open up the white clamp. See, I'm kind of pull out, push it in. I'm gonna pull it out, push it in, do this 3 times. What I'm doing is mixing that heparin, and that heparin prevents blood clots. And so now I'm ready to go ahead and connect. So here's my blue line. The machine's right here to my right. Take off the needle. Go ahead, drop that. The blue line goes on top, and now I'll go ahead and connect my red line. Now it's not a big deal if you connect it backwards, but it's not advisable to make a habit of it. So blue is on top, red is on bottom. Okay, so they're now both secured. Open, open clamp. Open, open. Okay, go in my machine here, start it. Okay, so again, take my gloves off, and this is my little arm belt. So, okay. So let me get this machine going. 2, 4, 5. Okay, so we went through the first one. This is heparin, and this is just the line. And once a week, this is a bottle of iron, and I have to inject this bottle inside of me once a week. Let's see, let me get this up. Okay. So what I do is you get this off and you pop the cap off and see, and you have the needle, you stick it in there, and then you get it all out. You know, the needle's about right there, then you kind of, and then put that back on there. And so when you're ready, at the end of treatment is when you put this stuff in. You get the, let's see, the bottom line, the blue line. You just disconnect this and screw that onto that, and then slowly inject it. And then you follow it up with one of these saline syringes. And so that, again, this is called, this is iron, and I do this once a week. Let's see. All right, and so the next medication, this is called Retacrit, and I would inject this in me once a week, but lately I haven't had to do so as per instructions from my nurse. And you have a little saline, you know, needle here. Not, it says saline, but just a little needle here, so you can barely see. I don't know if you can see the needle. It's very tiny, and you just stick it in there, and the nurse might say 0.65, 0.75, 0.85, but lately I haven't needed it, and I'm not quite sure what it's for. And so again, it's called Retacrit, and I'll put this in the video description. Okay, I'm having to increase the blood flow speed, so okay. All right, now the next medication I take is called Calcitriol, and this one I take Monday, Wednesday, Friday. And that's why I mentioned it's hard to remember all this off the top of my head, so I downloaded an app that reminds me when to take these. So this one's just 3 days a week, Monday, Wednesday, Friday. This is called Calcitriol, and I think this has something to do with something that's right here. They talked about my thyroid. So the next one is, I'll go through it. This is Lokelma. This is a little powder pack, and it's a little bit of powder in there. You mix it with a little bit of water, and it doesn't taste bad. There's really nothing to it. It feels like sand. And I mean, let me increase the speed on this. Okay, when I'm saying the speed, I'm talking about the blood flow speed. They want 350 milliliters per minute, the blood flow, so that's what I'm adjusting. So again, this is Lokelma. I take this every morning, just mix it with a little bit of water. The next one is called Cinacalcet. And I take one of these every evening at 5 o'clock. And so let's see, this one, okay, these two here are for my blood pressure, and all these medications that I'm talking about, that's what I'm currently on. Throughout the journey, your medications are going to change. So this is what I'm currently on. So right now, I take these two medications for blood pressure. This one is called Amlodipine. Amlodipine, 5 milligram tablet. I take this at 5 o'clock. And this one, this blood pressure pill is called Carvedilol. Carvedilol, 25 milligram tablet. I take this every morning. And so, and this right here, Senna Plus. Senna Plus. This is a stool softener. I take this as needed. I don't need it very often, but they give me a big bottle of it. And this one here is very, what's going on? Okay. And by the way, this machine, they teach you at the dialysis clinic how to use this machine. It isn't hard. Okay, so this medication, this is very important. Well, they all are, but this one's super important. This is for phosphorus. Okay, I mentioned phosphorus in a previous video. Every food you buy has phosphorus. But what people like us have to do is avoid foods with added phosphorus. So you're going to have to learn how to read ingredients. And they teach you all that, the dietitian. So this is called Lanthanum Carbonate chewable tablets. So I don't know if you could, yeah, Lanthanum Carbonate chewable tablets, and I take a couple of them out. So see, these, they're chewable tablets, and basically if you've ever seen the candy called Sweet Tarts, that's what it tastes like, minus 75% of the sugar. So this has like a little bit of a good taste to it. So I chew on 2 of these per meal, and so 3 meals a day, so that's 6 a day that of these that I take. And but the monthly blood test will determine your phosphorus level. If the level is a bit elevated, they might tell you, or they will tell you, to take more of these. So now, one of the biggest complaints that people on dialysis have is difficulty sleeping, and I have that problem as well too. So there's a medication for that. These 2 medications are used to help me sleep at night. They work really well. And this one is called Alprazolam, 2 milligram Alprazolam, and this one is called Trazodone, 100 milligram Trazodone tablets. So I take 1 of each of these every night to help me fall asleep. And now all these medications, there's probably a half a dozen different medications that do the same thing. What they have to do with each individual patient is administer medication and see if they can handle any possible side effects, because all medications have side effects. Let's see, what comes to my head right now is a medication called Ropinirole. I forgot what that was for, but they prescribed that to me, Ropinirole, and it got me real sick. And what it did, it made my heart beat real fast, and it gave me diarrhea. So I stopped taking that one, and they gave me something else, and that worked for me. So that's kind of one of the bad things, is figuring out which medications will work for you. So again, that rounds up all my medications. And so here, let me kind of pan this over here. So so you see my medications right here. So we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 11, 12. So that's what I'm on there, and it's a lot to keep track of, and but you know, it's worth it. And the dialysis clinic provides all these medications except one. Which one do they not provide? This one, the Alprazolam. I get this from a local pharmacy, but the dialysis clinic, they have their in-house pharmacy that provides all this medication for you, and they simply ship it to your house. And so that's it. Well, some of it is shipped to the local UPS store, and I have to go over there and sign for it. But some of the other medications, they just ship it to me, and the delivery guy just drops it outside my front door, and so I've been lucky so far. No one has come and stolen it. But you do get a delivery notification, and you know, a tracking that when it's on the way and when it's dropped off, you get the notification via text, and so you can, you know, go try to get to it as quickly as possible, because my neighborhood, we have a good bit of package thieves, porch pirates as they call them. But yeah, and but yeah, now again, I'm in my 3rd year of doing this. The first year was a lot of trial and error, and it got better the 2nd year, but the 1st year was the worst, because we're learning what medications work for me, which ones don't. The 2nd year, you know, better, and this is you know, my 3rd year. Like I said, today's June 2nd. June 9th was the last of 2021 was the last day I worked. So we're coming up on exactly the 3-year mark that I've been off. And so, but yes, you got to stay on these medications. A lot of patients are bad about forgetting to take them, and so that's it. And let's see if there's anything else I can think of. I was told that when I do get my transplant, the medications that I'm going to have to pay for, I think they mentioned the first 2 or 3 months. He said it's going to be in the neighborhood of $300 out of pocket the first couple of months. And then after that, the monthly medication is going to be about $100, a little bit under that. And with a little luck, within a year or 2, I might not need to take any medications at all. And so the medications that I'll have to take upon getting a transplant are called the anti-rejection drugs, and it's to keep my body from rejecting the kidney. And so that is about all I have, you know, on the medication. And so thanks for watching, and stay positive, and you know, we'll all get through this. Have a good day.